CBS 13 is fighting back against Maine's drug crisis. In our state last year, a record number of people died from drug overdoses. State leaders say heroin abuse is now an epidemic. CBS 13's John Chrysos has a look at the impact heroin is having at home.
The natural beauty of Maine might mask our state's heroin problem for some, but not for Andrew Kazoulis.
I found my roommate overdosed. He was one of the many that has fallen victim to a fatal overdose.
Brennan DeKesheter died in March 2013. That same year, 175 other people in Maine also died from drug overdoses, 34 of them from heroin. At the time, Kazoulis was just getting his footing on his own sobriety.
I certainly struggled to find ways to use that experience in a positive and productive way.
Now a senior at the University of Southern Maine, Kazoulis is the founder of Portland's Young People in Recovery group.
This is what I've been able to do since.
Helping others who suffer from substance abuse disorder and standing up for those living in silence and shame.
Yes, I'm a recovering person, personal long-term recovery, and I'm incredibly proud of that.
He knows there's a lot of work to do as more people get hooked on heroin and its new, more powerful cousin, fentanyl.
These are drugs that aren't in some other state, some faraway community, but they're right here in Maine.
Roy McKinney is the director of the Maine Drug Enforcement Agency. He says his agents are finding the synthetic narcotic fentanyl being mixed with heroin or sold as heroin.
This is nothing made in Maine. This is all not even in the United States, but out of country. And to be precise, it's Mexico. It's being smuggled into Maine by out-of-state traffickers, all for the price of making money.
Mainers are paying the price. Last year, 100 people died in our state from heroin or fentanyl overdoses. In the first half of this year, there were 63 deaths from those drugs. Compare that to just 7 heroin deaths in all of 2011. Federal data show 80% of heroin use starts with a doctor's prescription for pain medication. McKinney says pills are harder to get and more expensive, so many people turn to heroin, a cheaper and stronger alternative. For example, numbers from the MDEA show a 30 milligram oxycodone pill is selling on the street for about $50. The heroin equivalent is about $20 to $30.
It's all about finances.
What is your strategy for fighting back?
Well, our strategy is looking at the traffickers.
McKinney says enforcement alone won't solve the problem. There also needs to be support for treatment, like the kind of help Andrew Kazoulis says he got when he was ready to turn the corner on a path to recovery.
For me, that was my mother. My mom, she knew I could do it. Fortunately, when I asked for help, I was met with compassion and I was met with help.
And there is help available. In fact, drug addiction experts say there are many pathways to recovery. Tonight, our On Your Side Help Center is staffed with volunteers from the Maine Alliance for Addiction Recovery and the Opportunity Alliance. So you can give us a call right now at 1-877-494-6308. If you do have a question about addiction and the resources available here in Southern Maine, we are here to help. We'll also keep that toll-free number at the bottom of your screen throughout this newscast, and we will be taking your calls here until 7 o'clock tonight.
As the heroin epidemic sweeps across the nation, it is not only devastating addicts and their families, but also entire communities.
CBS 13's Marissa Bodner shows us how the drug is impacting crime rates, emergency rooms, and everyday people.
I don't ever come to Deering Oaks.
Lori Batchelder did visit Portland's Deering Oaks Park last summer, and it's a day she'll never forget.
I brought my children, my 1 and 4-year-old at the time, to the splash pad. It was in August.
She says it was about 10 a.m. when a man came stumbling down the hill and then dropped to the ground.
He was blue, he was not breathing, and he had a needle in his neck.
It was a heroin overdose. Batchelder says police tell her that man survived.
It just changed my life.
We may not always see it firsthand, but the effects of heroin are far-reaching.
This epidemic is certainly national. But it's happening right here in our backyard, and we're seeing evidence of this every day.
Portland Police Chief Michael Soschuk says robberies in the city are up 40% over the same time last year.
A vast majority of the time, they're substance abuse related.
He says it just goes to show how desperate addicts are to get their next fix.
When it may step outside of their moral boundaries, but they don't want to get dope sick, and they will do whatever it takes.
The Portland Fire Department is responding to more and more overdoses, often treating them with Narcan, a medication that reverses the effects of opioids. The number of doses administered has skyrocketed. By the end of the year, it's expected to have increased 200% since 2012.
They tend to come in groups, and I think that definitely has to do with what type of heroin and what's mixed in with it.
Dr. Andy Powell oversees the emergency rooms at Southern Maine Healthcare in Sanford and Biddeford, which have both seen a spike in overdose patients.
We've seen a little bit of a drop-off here in the last month, but we're still seeing significant complications of heroin use as well, ranging from, or the biggest one being an infection, abscesses, that sort of thing.
He says there's also a big increase in the number of patients asking for help, but many don't have insurance and can't afford treatment options.
I would say it's a big impact on the emergency department because it's very challenging for us. We want to help, and sometimes we don't have a lot to offer.
Batchelder is hoping to change that with a community coalition called Help Maine Recover, which kicked off a few weeks ago.
It's really important because nobody knows where to go.
She says people who want to help will be connected to those in the recovery community.
So it's not about just collecting money and your time. It's it's everything down to somebody in recovery needs help writing a resume.
Batchelder would like to see the stigma of addiction disappear.
That would be great if we could come together as a community and let them know that they do matter.
Using her life-changing experience to change lives for the better. In Portland, Marissa Bodner, CBS 13 News.
And as you heard in Marissa's story, heroin is really having a devastating impact on entire communities, but there is help available statewide. And we're here tonight to connect you with some of those resources. You can give our volunteers a call in our On Your Side Help Center at 1-877-494-6308. They do have answers on some of those resources available. And with us here tonight is Darren Ripley from the Maine Alliance for Addiction Recovery. And Darren, first off, thank you for being here. I know that you and the Opportunity Alliance have been busy taking calls tonight.
Yeah, thank you, John, for having us here. We have been busy.
Yeah, we appreciate it. So I know that you believe there are many pathways to recovery, but the first step is, where do you even start?
Well, a lot of it is starting as the person that is wanting the help. We have a lot of folks out there that are reaching out right now and needing the help. And where do they go? That's the thing, is where do they go for that help? So I'm hoping, by fielding a lot of these calls, we're helping people, find those resources. There is the Substance Abuse and Mental Health Services, the state of Maine. They can call there and find help. They can call the Maine Alliance for Addiction Recovery at 621-4111. You can call 211-MAINE. And we also have, I believe you're running it on there, is the Maine Alliance for Addiction Recovery's Community Asset Map, which we have 544 entries, which will help folks find residential or treatment agencies.
Yeah, you've spent a lot of time putting that map together. We have a link to that on our website, WGME.com. I know you want to get back to the phones, answer some more calls, and we'll keep that number up for you on the bottom of the screen throughout this newscast here tonight.
As hundreds die from heroin addiction every year, towns all across Maine and New England are trying to figure out how to best fight the problem.
And as CBS 13's Jennifer Long shows us, some towns are willing to try something completely new to save lives.
Small town Paris, Maine has a big drug problem.
There's a lot of heroin use. I know that.
Jessica Patton will tell you it's everywhere, and addiction impacts nearly everyone.
I have people in my family, my husband's family, we've just recently had someone pass away in his family from it.
That was 18-year-old Cassidy, who had just graduated from Oxford Hills High School. Drugs also took Patton's ex, her daughter Brooklyn's father.
I said, well, Daddy's now an angel in heaven watching over you too. And she looked at me with her eyes and her pupils got huge and she said, Mommy, did my daddy die?
Chris Hall died in his sleep after overdosing on a concoction of drugs. Little Brooklyn was just 4 years old.
It was the hardest thing I've ever done.
I know there was another OD in the county yesterday.
Law enforcement is also facing a hard task. Paris Police Chief Jeffrey Lang says with 33 reported overdoses in Oxford County so far this year, it's common knowledge addiction is a problem.
It's cheap, it's readily available, unfortunately. It comes up from Massachusetts, and it pipelines right to this area.
But right now, there's no consensus on how to fight it. Governor Paul LePage called for more DEA agents, more drug prosecutors and judges this year. And under the new budget, the Maine Drug Enforcement Agency received 4 new agents.
The drug issue is huge.
Following the governor's drug crisis summit this summer, we learned Maine state police officers will be working with the National Guard to track down dealers.
DEA's focus is not on the heroin addict. We are targeting drug trafficking organizations.
And now we're also seeing new ways to fight addiction, methods that have never been tried before.
We decided that it was time to try a different approach.
Gloucester, Massachusetts Police Chief Leonard Campanello tells us heroin is a problem down south too. With 4 overdose deaths in the first 3 months of 2015, Chief Campanello decided it was time to do something different. He wrote a Facebook post that outlined his plan, and millions took notice.
2.4 million hits, shared another 30,000 times to another 30 million people, and so here we are.
Gloucester started the first police-assisted rehab program. Addicts seeking help can come to the police station with their drugs. Instead of handcuffs and a jail cell, they'll get into a rehab program and be assigned a mentor called an angel. Their rehab is paid for with state seizure money.
We couldn't think of a better way to spend money out of drug dealers' pockets than to put it into the care of those people that they help to get addicted.
In just 4 months, the Gloucester Initiative helped place 220 addicts in treatment facilities, and already police departments across the country are taking notice.
We have fought the battle with enforcement for decades, and I haven't seen a dent yet.
Chief Lang says the Paris Police Department is working on creating a program similar to the Gloucester Initiative. So is the Augusta Police Department. And earlier this month, Scarborough launched Operation Hope following the same idea.
This initiative flips all the thinking outside the box, and I can see it's working. You can definitely see the analytics that Gloucester puts out and these other departments put out, and see that it's working.
I think that's awesome. That's really good.
Patton says she's glad to see the police do something to try to help. She's already talking to her daughter about the dangers of addiction in hopes history won't repeat itself.
So when she grows up, hopefully she'll learn from this and not do it herself.
In Paris, Jennifer Long, CBS 13 News.
Well, as you heard, from rural towns to the suburbs and here in the state's biggest city, really no corner is untouched by our state's heroin epidemic. And we do want to help get you answers and connect anyone with a question about addiction to the resources that are available. Our On Your Side Help Center is staffed right now with volunteers from the Maine Alliance for Addiction Recovery and the Opportunity Alliance. A number right there on your screen, 1-877-494-6308. We will be taking your calls until 7 tonight. So do give us a call. We are here to stand with communities and help fight back.
Recovery, a short word that for some has an insurmountable meaning. Right now, heroin use is increasing in the state of Maine, yet treatment options are decreasing. Fox 23's Maria Valdenas looks at how the recent closures of 2 recovery centers are affecting people trying to get and stay clean.
A growing problem.
It's increasing exponentially daily, the amount of people that need help.
With a shrinking number of answers.
Is there enough treatment? Absolutely not.
Today, there are fewer places in Maine for addicts to get help than there were last year. In July, Mercy Recovery, Southern Maine's largest treatment center, closed its Westbrook facility. The following month, Spectrum Health, the only clinic in York County, announced it was closing. Both say a decrease in state reimbursement is to blame.
Medicated assisted treatment.
Steve Danzig has been helping locals get clean for 20 years, including at Mercy. He says with the state leading the nation's heroin epidemic, it's hard to believe treatment centers here are closing.
It's just completely baffling.
So what happens to the patients trying to get clean? In May, Mercy Hospital said they move 1/3 of their patients to their Portland facility, and they'd place the remaining 166 patients with other doctors. We reached out several times for an update on the process, but hospital representatives never got back to us. Meanwhile, Spectrum Health officially closed their Sanford clinic last week. PR manager Brandon Melican says the organization placed all of their 105 patients with other doctors close to where they live. However, Kara Payne, a recovering heroin addict, says even the smallest change risks a big relapse.
That's a big deal for a person who's trying to stay clean or to get clean.
Payne says she got clean because she was forced to, saying she got in trouble with the law and that it was the best thing that could have happened.
I detoxed in jail and then was court ordered to do intensive outpatient and substance abuse counseling.
As treatment centers close, Payne is training to become a certified smart recovery facilitator so she can offer free meetings to addicts. Payne is urging others to help get more support in Maine, too.
It's very important for them to write to their local and federal governments and try to, apply a little pressure.
Experts say it's also important addicts know they have options even if they don't have money.
One of the things that is largely overlooked with private treatment centers, which is where I'm working now, is that many of them, I would say probably most of them, including ours, are taking insurance. And people don't realize that.
Danzig is now the executive director of New Freedom Academy, a private rehab in New Hampshire. He says insurance companies rarely inform clients they have out-of-network benefits that can pay for treatment. Danzig says it's better to call the treatment center before the insurance company so they can help you figure out a plan of action. This is also a good way, Danzig says, to wean out facilities that don't actually want to help you.
There's some places that, their first question is, what's your insurance? How are you going to pay for this? They're looking to put people in beds. Mm-hmm. If that's the first question that you get when you call a place, hang up the phone. Hang it up, because you're not going to get what you're looking for there.
Danzig says heroin addiction is like a virus. The only way for it to stop spreading is for everyone to educate themselves on how to prevent it. Maria Balvanas, Fox 23 News.